Here we are again, Pat.
Hi, Jonah.
If somebody chooses to watch these all in one day, it's going to be great.
Well, this one's going to be just a little bit different. This is one we haven't done before. And it's the only one that we can say is not a supplement to the manual.
True enough. True enough.
We're always saying, this is just a supplement. You have to read the manual. But what we've decided to do on this particular webinar is to just give some tips, just things that we've gained by experience as examiners, having done the exam for lots of years, observed a lot of candidates, just some of the information that we always share with their educators, tips for students, but we decided this year to do a presentation directly to the students. So it's a little bit of a brain dump, and it's just some observations and suggestions that have come from examiners, chiefs, CFEs, and we just thought we would share them with the candidates. Is that a fair explanation of what this is all about?
I think so. I think for the people watching and candidates as well, this is a little bit more laid back. This is a little bit more, this isn't quite so much presentation, but just kind of some talking points that Pat and I may bring up in between here and there, but not that formal kind of presentation feel. So sit back, if you've got any questions, of course, we'll follow up with how you can reach us after this, but take this for what it's worth. It's just some helpful tips that we've collected along the way. And so with that, I'll start the presentation, Pat, and I'll let you take the lead.
Okay. And I'll also say a lot of this they'll hear again, probably when they go to registration the morning or right before your exam. A lot of this information is covered by either the chief or the DSM. But it's good to hear it more than once. And sometimes it's good to hear it before you get there.
Yep, absolutely.
Like the first one right here. It's too late. It's too late at registration for someone to tell you, come to the exam with your forms already filled out. Okay.
Yep.
All the forms are available on the CDCA website under the forms tab. And again, this is a bit of a stress reliever and it's a time saver. If you have your medical history complete, you have your release of liability form complete. If you have everything in order, you can even already sign your some of you. You're not going to sign those two forms, but some of your other forms. If you have them all together and filled out, it's one less thing for you to do the morning of the exam. When we start putting ID labels on forms, you can use the ones that you've already filled out. You don't have to use the ones that come in the envelope. The only exception we make to that is the progress form. The progress form that you get on site the day of the exam is the one that we want you to use. If you want to fill it out if you want to fill it out ahead of time and then just copy that information over onto the progress form that we give you, that's fine. But medical history, release of liability, all of that, I really suggest it's a time saver to have it filled out ahead of time. Another thing that this has happened to students, and it's really a heartbreaker, is that they take the blood pressure when you're screening their patient, and it's kind of high, but it doesn't they don't need a medical clearance. My suggestion to you, and it's a strong suggestion, if the patient's blood pressure is anywhere close to 159/93, either reading, to get a medical clearance just in case. Sometimes patients get up in the morning, they're rushing. We have patients that drink Red Bull in the morning. I'd say that's another tip for a candidate. Tell your patients, no espresso, no Red Bull, none of those drinks in the morning, because it does elevate blood pressure. Often,
and the patients may be nervous as well. I mean, they may be, this is an exam setting. Everybody's kind of nervous as it is, so they're just walking into that feeling. So completely agree. It could be anything, but that particularly.
Yeah, they want to make sure that they're on time for you and they want to do their best. So better to have a medical clearance and not need it than have your patient not be eligible because the blood pressure is too high.
Yep.
So again, that's something that's too late to tell you at registration. That's good for you to have the information beforehand. If you do the radiology webinar, we always stress, and the manual does too, to make sure that the apices of all of the roots of the teeth in the case selection are visible on a radiograph. Look long and hard and just really make sure. If they're not, then don't submit the patient. They're just not going to be eligible. Make sure that you bring a closed, or make sure that you bring a container to transfer your instruments back and forth. Some sites, the instruments are provided at the site in the evaluation area, and you don't have to send instruments back and forth. But if you are going to be transporting instruments, and this you can find out from the site that you're going to be at, and I recommend contacting the site to find out, if you are going to be transporting instruments, make sure that you bring a closed, sealed, puncture-resistant container that you're going to put your instruments in to be transported back and forth from the evaluation area to the candidate clinic.
Yeah, and before contacting the school, if you're going to an open site exam, check their facility information page that is on our website. So check there first and see if it's listed. A lot of the sites will have these listed, and you'll know it will save you a phone call.
Right, really good point, and it saves the school from getting lots of calls too.
Yep.
So that information sheet has a wealth of information on it. So be sure if you are going to an open site that you do check that. That could be another tip that goes to you. Avoid strongly discouraged conditions. We talked about those. This would be rampant caries or a tooth that's really bombed out or an orthodontic appliance. These just increase your risk. You can do it. You can scale around them. You can, hopefully if you have a very mobile tooth, you don't pull it out. But every one of these that you have just increases your risk. And this is a day that you don't want to have a lot of risk going in. So I know sometimes it's hard to get a patient and you do the best that you can, but if at all possible, avoid those strongly discouraged conditions. Again, don't submit a patient that doesn't qualify. If that morning the blood pressure is too high, don't check in with the CFE. But I do recommend, and they'll tell you this at registration, if you have a situation, whether it be your radiographs, your medical history, your blood pressure, that you're afraid that they don't qualify, don't officially check in, but make sure the chief and the CFE knows that you're having an issue. And they'll be able to help you through it, maybe find some substitution areas or help you pick another, or advise you about picking another case selection quadrant or whatever. So just don't set yourself up to fail. Don't submit a patient that you know doesn't qualify. That's an automatic failure of the exam. Informal.
Well, and one thing, Pat, on that was, you said CFE, and so just for those who haven't yet, maybe you started with this video. CFE stands for Clinic Floor Examiner. Those were the examiners you'll have direct contact with and be able to talk to. They're there to help you both with paperwork and any questions. So Clinic Floor Examiner is our, CFE is that acronym for that, in case you wondering, what's a CFE?
Great. Yeah, thanks for clarifying that. We all speak in acronyms. And we forget that not everybody knows. So perfect. I'm glad you brought that up. Talking about calculus for a minute. Calculus must be moderate to heavy subgingival to be qualifying. There's no such thing as light qualifying calculus. So think about the way you classify your patients in clinic. If somebody is however you call it, if somebody is a light patient, they're not going to qualify for this exam. you have to have not only the quality of the calculus, but it's also the amount of calculus. It has to be moderate to heavy in order for it to be qualifying.
So can I say one thing? So on the bullet point above that said, don't submit a patient that doesn't qualify. My mind when I read that was, don't submit a patient that doesn't have the qualifying calculus. Don't try to sneak one by or try to just see if you could get that patient in. When I read that, that's what I thought. So when you start talking about that, I go, oh yeah, that's a good point too. But same thing, don't cross your fingers and hope that patient has qualifying calculus. Go in confident knowing that they do.
And it's funny that you bring that up, because so many times examiners will say they'll go through and try to verify the 12 surfaces of qualifying calculus that the candidate has submitted. And sometimes you just can't do it. It just isn't there. But a common comment from an examiner was, I don't know why they picked this quadrant. There really was not enough in there. It was really light. If they had picked this other quadrant, it would have been perfect. Mm-hmm. So I think sometimes the tendency is, I'm going to go a little bit lighter. I don't want to go too heavy. I'm going to go with the lighter, with the lighter quadrant and keep my fingers crossed. I don't recommend that.
No,
I'm not saying, because the next bullet point down here is, you don't want something that's too difficult, but somewhere along here we say pick the best quadrant in the mouth, and by best we mean with the most qualifying calculus and not just the bare minimum. Yeah, so that's another way of looking at qualifying. Yeah. Right? So here we are, pick the best quadrant. It's too bad when there's calculus in the mouth, but the candidate doesn't select it and then ends up not having enough calculus. So, so be smart about it. You've got the skills, you've been well trained, you know how to remove it, trust yourself. Have the confidence that, I'm not saying, go too heavy, but have the confidence that you're able to remove it and pick the best quadrant. And I will tell you, most people, I always laugh when I get a maxilla. It's like, whoa, because everybody does the mandible because it's easily accessible. The visibility is good. It's easier position-wise. But if your best calculus is up on the maxilla, choose the maxilla. So it's not ease of access or vision. It's the quality and quantity of calculus that we're looking for. The other thing is, don't pre-treat the patient. I know there's a lot of discussion about that. It's the end of the school year. You want to finish up the patient before you graduate because he was a clinic patient. But you're taking away some opportunities that might come your way if the calculus was still on the teeth. When we need, definitely don't pre-treat anything in your case selection. Examiners, as you know, select 2 additional surfaces of calculus. And if you scaled it all off and it isn't there, you're not going to get that benefit. But sometimes too, it's decided that, let's say that morning, the patient has a lesion in the area of your case selection, and maybe you need to change your case selection to another area in the mouth. If you've pre-scaled that patient already and removed all the calculus, you're taking away some options that might have been available to you had you not treated them. So I recommend don't pre-treat them. If you're finishing up in clinic, hand the patient down to one of your first-year students or somebody who's going to be coming back, or go back and treat them. But I highly recommend not pre-treating your patient. So often, while I'm talking to candidates when their patient has gone in for evaluation, they'll say like, oh, I just wish I could have told the graders that he just really, his tongue was always in the way, or I couldn't establish good anesthesia, or they were really jumpy, or they were very sensitive. You can talk to them. by the candidate notes section on the progress form. That's where you can put anything you want down on that, in that section. That's where you're writing for radiographs, if you need to write comments about radiographs, but that's where you write those things that you wish the graders knew before they were grading you. If there's a pre-existing, some kind of a tissue irritation, don't get blamed for something you didn't do. Write that down under the candidate notes. So you can speak to the graders by using candidate notes on the front side of your progress form. And don't be afraid to use it. If you're in a state that allows anesthesia and in a school that allows it, I recommend using it. Oftentimes patients say, oh, I'm okay, I don't need it. And then you start to treat them and they really are sensitive. I would talk to your patients beforehand and tell them that you are going to use anesthesia, that you would prefer to use anesthesia. It makes you, or it allows you, I think, to work more efficiently and probably faster, because you don't have to keep stopping because of patient discomfort. And you don't want the patient to be discomfort. So it's to everybody's advantage, I think, to use the anesthesia if it is allowed. You should explain to your patient when you are, not the day of the exam, but when you agree, the patient agrees that they're going to be your patient and you start making arrangements. I think you should explain that there is a possibility that they may not receive treatment that day. There may be some reason that the patient is disqualified, whether it be blood pressure or maybe a herpes lesion or something. Chances are it's not going to happen, but cover yourself and just mention to the patient there is that possibility. And you can give some examples of what might happen, what might be some of the things that would stop the exam. After pre-treatment evaluation and your patient comes back, you're going to be assigned a calculus, 3 calculus detection teeth and 2 perio probing teeth, and you're going to be given a finish time. Look at those, check them, and make sure they're correct. Your probing teeth are within the case selection. Your calculus detection teeth are outside of the case selection. And you have 2 hours to treat the patient. So look at all of them and just make sure they make sense and that they're correct and that it wasn't an error in writing them down. If you think there is an error, if by chance they gave you 3 hours instead of 2 hours, make sure that you tell the CFE, or if they only gave you an hour instead of 2, again, tell your clinic floor examiner and get that straightened out before you start. I don't think I need to say hand scale after you using your ultrasonic, but make sure you
might want to say that.
Make sure you leave time to do that. That always you need to hand scale after your ultrasonic. The finish time that's on your progress form is the time that you should be in line. And I think we say this later on. That's the time that you should be in line ready to check in with the DSM. You want to stop at least 15 minutes before your finish time and make sure to probe. I think sometimes you get in that zone and you're scaling and you're just in treatment and you're scaling and you're flossing and you're doing whatever and time goes by. Stop. You don't want to run out of time and not probe because that's 6 points that you can lose. So make sure that you do leave time to probe after your treatment. Whatever you're going to do in the last 10 minutes or so is not going to make any difference in your probe readings. So when you've gotten to that point so close to the finish, stop, do your probing, and then if you still have time to go back and finish what you were doing. But remember, the finish time is not the time you put down the instruments. It's the time that you are ready to check in for post-treatment evaluation.
I have a question. I'm going to ask you a question here because this is a question I get quite frequently. Because we don't allow, you can't have your smartwatch on, your phone. How are they able to make sure that the time that they have is the same time that's being recorded for them and when they need to be done?
Okay. We often, again, remember when I said after pre-treatment evaluation, when the forms come back, check for accuracy, make sure that your teeth are the right teeth and the time. And
Right.
whatever the clock is in the clinic, go by that and make sure that 2-hour time it goes along with the clock that's in the clinic. We always ask the clinic floor examiners to give warnings. The finish time is written on your cubicle card, which is posted right in your operatory. So if you forget what your time is, you can always look up. And the CFEs, or the clinic floor examiners, are asked to give you a warning. They give you a 15-minute warning and if it's close, you're going to see people hovering around you to make sure that you get your patient to the desk in time. Remember, whatever piece of calculus that you're working on that is keeping you sitting in that chair when you should be packing your patient up to go to evaluation is not worth it. If you leave some calculus on one surface, that's only worth 5.5 points. If you're late in checking in, that's a violation of the time guidelines, and that's 100-point penalty. So it's not worth being late. So watch your time, watch your warnings, make sure that you leave time to probe, and make sure that you are at the sign-in desk with the DSM at your finish time.
So the other thing I'll add here, Pat, though, is I don't want the candidates to feel like when the examiners are hovering over you to make you nervous, right? This is not about trying to make you feel nervous or any of these things. The other thing I'll warn you or would like to say is don't depend on that 15-minute warning either, right? Don't go in thinking somebody's going to come tell me that I have to stop, because that also isn't the case. That may or may not happen depending on the exam site. So, you are responsible for your time, but at the same time, when they're trying to help you finish up, don't take the pressure and feel like, oh my gosh, they're applying all this pressure to me. Just know that they've got an idea of when you're supposed to be done, and they're there to help you. They are not trying to make you feel pressured or any additional stress than what the exam itself is already doing.
No, absolutely. And yeah, thank you for bringing that up. When I say hover, if you're getting down to a few minutes, we always say we're not going to let you, and we'll tell you during registration, we're here to help you with the process of the exam, and we're not going to let you do anything wrong. We're not going to let you not meet with the DSM. We're not going to let you have the wrong paperwork, because if you do, we're going to make sure we come back and get it for you on all of that. And we are going to try our hardest to make sure that you don't get a 100-point time violation. Yeah. And that's what I meant by hovering. We're going to just make sure that you know that it's time. And we do try, absolutely, we always try to give that warning, but you never know what's happening in clinic at the time, and we can't depend on it. Make sure you send the correct instruments to the evaluation area. I always suggest to candidates that you have a set of exam instruments. You have a mirror, an explorer, and a probe. And you have a patient napkin with a label on it that you just set aside, and you have it over. And when it's time for your patient to go for evaluation, you just take off the patient napkin that they're wearing, put on the evaluation one, and pick up that tray, not the instruments that you've been using, just what I call your exam instruments or your grading instruments. Pick up the tray and leave. And so that way you're not frazzled and saying, okay, what do I need to bring? You've already decided, you already have it on a tray, you already have them ready to go. So that would be my suggestion. Have your exam instruments and have your patient napkin with a label on it all set to go. Okay. If you can, and I know this is pie in the sky, maybe they have a pool of backup patients, but if you can, if as a group at your school you can do it, just have a couple of backup patients just in case. We all realize that getting patients is difficult, but if you start off with that goal of maybe getting a few extra patients, you could all benefit from it. If during the course of the examination you don't understand something, you're not sure where you're supposed to be, you're not sure if you're supposed to have signed up or not signed up, or is the clinic floor examiner going to come to me, or do I have to go to them, whatever? Just ask. There's a lot of people out on the floor that are there to help you. That's why they're there. There's going to be at least 2, if not more, clinic floor examiners. There's a chief, and then there's the DSM, the person who enters your data. The job of those roles is to help you with the process and guide you through the exam. Just ask them. Don't sit in your operatory and just kind of like, oh, no, I'm not sure what I'm supposed to do, but I know they told me, but I don't remember. Don't put yourself through that. Just ask. Just come right out and say, I know you said it, but I don't remember. Okay, just ask.
We say that all the time around here.
That's right. I know I'm supposed to know this, but I don't.
But I don't.
Yeah, just tell me where I'm supposed to go and what I'm supposed to do. Okay, so here we go. The CFEs, which is the clinic floor examiners, the DSM, which is the data systems manager. Again, that's the person that you meet with to put in your case selection, to put in your candidate findings, and the chief. They're going to help you with the paperwork. They're going to help you with the exam process. I always say you can come to the exam and be nervous, but you can be nervous about a whole lot of things, but don't be nervous about the paperwork, because there are people there that are going to help you with it. That's one thing that you can kind of cross off your list. And it's, I think, most important not to feel rushed or not to feel hurried. You've got plenty of time to do this exam. I always joke, and I always say at the registrations that I do, it's going to be probably the last day in your professional career that you'll ever be given 2 hours to scale 1 quadrant. So I always say, enjoy today. It's the last time it's ever going to happen on your exam day. So those are just some of the tips that we wanted to share with you that maybe will help you prepare. Maybe will help you when you get there to feel less stressed, less anxious, and just give you the opportunity to always do your best. Thanks for listening.
Yeah, thank you for listening. If you have questions, you can go to our website at cdcaexams.org, select the Contact Us button, and submit a question right through there. So we appreciate your time. Thanks for listening. Pat and I love doing this. We look forward to seeing you out at exams. So make sure you give us feedback when you see us in person. Pat, I hope you have a great afternoon.
Thanks, you too, and hope to see you at exams.
Bye-bye.
Bye.